Welcome back to the Yappy Hour, powered by Yappily. I'm Nathan Dunleavy, and this is the podcast where we celebrate life with dogs and learn from people who care for them, love them, and sometimes speak up for them in ways us humans need to hear. Now, today's guest is someone I'm really excited to have with us, Dr. Charlotte Gray. She's part of Vetsy, the online vet service, making it easier than ever for pet parents to access trusted advice. Whether you've got a nervous pup who finds the vet visit overwhelming, or you just want to nip these worries in the bud before they snowball, Charlotte's here to show us how veterinary care doesn't have to be stressful. We'll be diving into the benefits of online vet consults, how we can prepare our dogs for vet visits with less anxiety, and why early positive experiences matter so much. It's going to be a really practical and reassuring chat, so grab a cup of tea, settle in, and let's get started. Welcome back to the Yappy Hour, powered by Yappily. I'm your host, Nathan Dunleavy, and I'm so excited to bring you another episode of the Yappy Hour today. Joining me is Dr. Charlotte Gray from Vetsy. Welcome, Charlotte. How are you doing?
Thank you. I'm very well. Thank you. How are you?
Very well as well. Yeah, I'm all good. Thank you. So Charlotte's actually over in Dubai, so there's a bit of a time difference as well. So appreciate you coming on with me this evening. It's actually night time here as well. So I do really appreciate you coming on. Right. So let's get going then. So I'm going to start, Charlotte, with a slightly cheeky one. But did you grow up as a kid always wanting to be a vet, or did that passion come later?
No, I definitely did. I knew from a very young age that I wanted to be a vet. I was in a family full of pets, and I was always the one bringing home the waifs and strays, and always trying to do my little bit with all of them. So yeah, it was decided at pretty early age I was going to do. I think I started like working in clinics, like work experience, and like cleaning up kennels and stuff, probably about 10 or 11. And then I've basically been in
Really?
since, and everything got honed into going into that direction. So yeah, it just naturally was always on the cards for me.
Oh, I love that. Thank you. So let's move on then to a little bit about your journey, Charlotte. So I think you've kind of touched on it a little bit there anyway, but what drew you into veterinary care in the first place after obviously, helping with all the waif and strays and stuff?
Yeah, I mean, that was it. I think when I was growing up, I actually grew up over in the Middle East. And so I was exposed
Oh, okay.
of strays. There's a lot of stray cats here, and it was just constantly, there was like always a need. And I'd always said, I was like, I need to get back out and work out there and do all my bits out there, trying to help them all. So it was always my dream to kind of do that. And it was always the plan to do that. And essentially, it was just a no-brainer. I couldn't actually see myself doing anything else. And then as I like got through A levels and kind of did the A levels GCSEs, everything was science based. I really liked medicine. I love surgery. So the idea of doing that, it just became more and more the field for me. And essentially, I don't think I could do humans. Animals
Yeah.
seem so much more easier to work with. So yeah, I think it was just naturally going to happen.
Oh, wow. And I mean, it's quite a big thing, isn't it, going to vet school? Because aren't you there like 5 years or something?
Yeah,
And
so
then,
in the UK, it's a 5-year course. It flies
yeah.
by, and yeah, you still feel like a little baby bird by the time you actually leave. But yeah, I mean, it seems like ages ago now when I was at the fun of vet school, but it is a 5-year
Yeah.
course.
Oh, wow. That's a long time. But like you say, it goes fast. Okay. So moving on to our next question. Thanks for that, Charlotte. So, what excites you about combining traditional vet knowledge with new ways of delivering it, like online consults?
Yeah, so I mean, in human medicine, it's quite common to do video consultations or teletriage, and it is becoming something that's more common in veterinary medicine as well. So it is still quite new, but we're always a little bit behind human medicine generally. But kind of the options available at the moment typically tend to be like a video vet service for out of hours care, or if you like through insurance companies. But
Mm.
There isn't really anything more than that. So although they can offer you the advice and say, yeah, there is an emergency, you need to be seen, there really wasn't anything more that can actually just support pets ongoing. And so, yeah,
Mm.
we wanted to create something that could do that. And essentially, we see ourselves like an online practice where we can offer that advice, offer that guidance, discuss cases, continue to see the same cases, not just be a one-off vet randomly in a call center. And that,
Yeah.
of the benefit being that if we are in a position needing to, we could offer you prescriptions for treatments as well, should it be needed.
Yeah. So, I mean, I love Vetsy. Obviously, you're my vet and in Vetsy, and you've helped me with a few of my gangs. So, yeah, I absolutely love what you're doing. I think it's brilliant. So, Charlotte, Vetsy, what is the mission behind it all?
Yeah, so when we originally came up with the idea, I mean, essentially what I wanted was it was planned for really the busy household. So the busy pet parent who's got the full-time job and kids and whatever, and just can't find the time to
Yeah.
get in between the kind of classic 8 till 7 of a vet clinic. And often, and I know myself, and I've always put my hands up as a pet owner, I would find it if I wasn't a vet really hard to get into a vet clinic. Just weekend
Yeah.
days and probably always having to be out of hours because I haven't found the time. So that was what I originally wanted to create, just a like convenient on-demand service for those busy
Mhm.
parents. But then it became actually more useful and more kind of helpful for a lot of other cases as well. For example, like really, really anxious pets and the value that it can bring to
Yeah.
those that are so stressed about the idea of a vet clinic, or the cats that just get terrified about going in a carrier, or the poor owners that are scratched as they try and get them into the carriers. But then also the
Mm.
owners that just physically can't get in with either transport or mobility concerns, or little old ladies who cannot get into the vet clinic. And also because the way we run, and essentially we are a video service, I don't have any overheads, that we can significantly drop the cost of veterinary care as well. And so the other
Mm.
option was that it is really there for those who are on a bit more of a budget or have financial concerns as well. And I became, because I still work in practice, so I still work,
You do.
and I became so aware of how expensive veterinary care was becoming and almost out of reach for a lot of owners. And unfortunately, if kind of how it works in the UK, if you are eligible for charity care, then great, because PDSA, Dogs Trust, they are fantastic, they are really good, but not everyone makes the cut for that, and therefore there isn't really an in between.
Mm.
And I wanted to have an option for people who can't always do the classic 50, £60 console and then everything else on top. And so they still feel like they're able to do something. And that
Yeah.
a big kind of factor for us as well. So it really
Yeah.
is, in summary, it's a service that's there for like kind of convenient, flexible, on demand, low cost veterinary care. And sometimes if you just want to talk it out properly, there's no time constraints on our consults. We are there to, sometimes you just need to really sit and digest information with your lot of second opinions, just so
Yeah.
in the pressure of a busy waiting room outside and you feel like the vet's hurrying you through because they've got to kind of get through their 15-minute appointment.
10-15 minute appointment. Yeah. Feel like the GPs.
Yeah, exactly. And they are under pressure, they are busy. It is very
They are.
it is. And so it was just a way, I'd like to hope and think as well that we are taking away some of the caseload to the clinics. If we're taking away the less urgent ones, they can then prioritize urgent cases, and we can try and help offset that for them as well, taking pressure off the vets in practice.
No, that's brilliant. It's all about sort of collaboration as well and helping each other. I love what you said about them, the pet parent trying to put the cat in the carrier and getting scratched. I've had a few clients where it's like the cat's known that it's the vet appointment and they've gone out and not come back. And
Exactly.
they're like,
Yeah, exactly.
they're just like, oh, well, the cat's like, oh, the cat's nowhere to be seen because he must know he's going to the vets today.
Yeah,
So they've had to miss the
they hear the
appointment.
phone call, I'm sure.
And they're just like, right, let's clear off for the rest of the day.
I mean, I get it on
Brilliant.
Vetsy
Thank
as
you.
well. I've had them where they finally get the call and they've got the cat sat next to them, and then we turn the camera around and the cat just bombs. I'm just like,
Clears off.
oh,
Yeah.
quick.
I, they're a bit different to dogs because dogs will probably stay by your side or sit on your lap or whatever.
No,
But the cats are a bit more promiscuous anyway. So they're just like, right, I'm after him, I think. Brilliant. So moving on, so we're going to be talking more about obviously the online vet model now, and we've touched on a few benefits of it, but the benefits for the guardians and the pet parents. So for dog parents listening, what actually is an online vet consult and how does it work, please?
So it's very easy. Even for those that don't think they're very tech savvy, it's very easy. Essentially, you go to the website, myvetsy.co.uk. You can book an appointment at a time that suits you, and the consultation itself is £39. That includes, so that's the actual consultation plus any written prescription, more than one if you need them. And then you can obviously source your medication online. But what we do is we meet for the appointment and it's done all through a video consultation. So a little bit like Zoom or Skype as we all these
Yeah.
days anyway, but it's all
Yeah.
created through the site itself. We have a good chat, kind of summarize your concerns and any previous history. We do a visual assessment of the pet. So you can flip the camera if you're on your phone or use your laptop as well if you need to. And we can just do a full kind of like check over. And, you do get a lot of information from that exam. So, we can check the eyes, check the ears, check the skin overall, we check the mouth, the teeth. And what I do a lot of is often kind of gait and posture analysis. So you can get a lot of information on the
Mm.
way that the dog's standing, or we can do full kind of walking, trotting. We get them to sit, stand, lie down, jump up, jump down, which are things that you don't get to do in clinic, when you're in like a small little consult room. So
Yeah.
yeah, we can get a lot of information in that sense. And then we tend to put together a little plan and essentially summarize where we're going to go from there. And then after the call, we send you through the aftercare plan, which is like
Yeah.
my
That's
my
so comprehensive.
yeah. So is that the reason I do it is because I know how when you're sat in a consultation and the vets are just talking at you, you can often walk out and just think, oh my gosh, what was it that they actually said
Yeah.
was the problem?
Information overload.
So they're so valuable to kind of have this plan. And I get the mick taken out of me because mine's usually like 3 pages long, but it's only because I talk too much. But I summarize everything that we've said. And then essentially that kind of list treatment plan plus any potential diagnostics that might be recommended, which we may suggest contacting your own vets for, or kind of follow up on if plan A doesn't work, what would plan B be, and things like that. And then we also
Mm.
send you any potential prescriptions that may be suggested. So that's where you can then take that prescription online to the pet pharmacies of your choice. I tend to say, just pop the name of the medication into Google and it'll come up with them all, and then you can shop around. And it's as simple as once you put your meds, you put them in your shopping cart, and at the checkout, they'll ask you to upload your prescription. So you can just attach it and it gets sent out in the post. And then we get the treatment going. And obviously, I check in a lot. I send emails or I'll send messages through the site just to check in on patients and make sure that you're happy with them. But if you're ever unsure, you've got questions, we're also available through the messenger on the site as well. So always
Yeah.
to my phone. I'll always get back to you when I can.
No, you do. Yeah, I've used the
Yeah.
messenger app or messenger functionality, and when you like you say you're free, you're very responsive and stuff. So it's brilliant. I mean, I'm a big fan and big advocate of it.
Fantastic.
As you know, I've recommended it to some of my clients, and some of them have used you now.
Yeah.
And you're working like alongside the first opinion vet or their normal vet. You ask for the history, you send your consultation and follow-up plan to their sort of main registered vet. So
Yeah.
you do work
It's
all joined up, don't you?
Yeah, I think it's so key to a big thing I've always said is we are not your replacement for your vet clinic. So I've had people email us to say, "Look, can we register with you?" You can always register with us, but you don't need your practice because you always need a brick and mortar practice. You'll always need someone who can do the diagnostics or someone that needs direct face-to-face care. So we're not a replacement, we're just a complementary service. And what we do is we completely keep everyone in the loop. So I get all the information from the vets just so I know what tests have been done. I can look at results. Obviously, don't then repeat anything that's then been done, but equally kind of can see what may have worked and what didn't work. But then equally, anything I've said, the same report you get gets sent to the vets because then it means they're kept in the loop. So no one's confused. And then if any vets wants to discuss it, then we can, which we have done as well with some cases, and it works. I find it works well, especially if you've got like a really anxious dog that the vets can't examine anyway, and it's going to take them 30 minutes out of their day just to kind of try and get the dog into the building, which is not fair on the dog. It's not fair on the owner. Not going to be examined like hands-on. Then that's where you're like, go video consult and we can liaise our findings. There's some dogs I've dealt with who have never had their mouth examined because they're usually muzzled in a clinic, but I can do a full dental assessment at home with mum and dad there to let them have a good look around and things. So, it does
Yeah.
his perks.
Yeah, it does. And like you've just mentioned, the benefits there for anxious or fearful dogs. So you're nervous, you're anxious dogs, like your reactive or spicy dogs.
Yeah.
Some that can't go to the vets, busy households as well. So I know that with the appointments, there's, you're restricted like to just maybe 9 till 6 or whatever to your main vet, but there's appointments available in the evenings and at weekends. There's no extra charge or out of hours. Like, please. And like you said, people with mobility issues, so those people that could be living in rural areas or those that have got mobility issues, they can just speak to you from the comfort of their own home. They haven't got to go anywhere.
Yeah, exactly. Yeah, I've got a really dear little client, a very naughty cat who always gets into cat fights and often ends up with bites and wounds and stuff. But she's got no transport, no family local. So we do a lot of kind of video calls with her and manage the wounds, which is brilliant. She does it all. She's so good. But yeah, and there's
Yeah,
ones that you just think like, what else would you do really if you don't have another option available?
exactly. So I think we've again touched on it, but just for our listeners and viewers. So why might someone, Charlotte, choose an online vet first instead of immediately rushing to a clinic?
Yeah, so there tends to be like a bracket of kind of appointments that would be I call appropriate for online veterinary medicine. So normally things like kind of chronic pet care, so anyone that's on long-term prescriptions and legally have to have their pets checked every 6 months under the Royal College. You need to have them assessed on a 6 monthly basis. So we can update those sort of prescriptions all being well, as long as we have some work to work with if it's needed, depending on the condition, as well as general geriatric care. So just that age in pets. So kind of those subtle cues or changes in thirst, appetite, energy levels, or kind of just general stiffness as well. We do a lot of pain management. So whether it's an
Yes.
injury that they've just landed awkwardly chasing the ball, or more likely your chronic ailments where they are just getting a bit stiff and potentially arthritic. I think that's kind of dominates a lot of consults essentially, and that we can do pain trials and pain kind of response to different treatments and see which one works. The other benefit we have is that we are able to also refer. So we can refer to other complementary therapies like physio and
Of course.
and
Yeah.
like that as well. So I work quite closely as well as with behaviorists, but also with those sort of complementary therapies, which always go hand in hand. The other thing we do a
You
lot
do.
of skin. There's pesky allergies and kind of food allergies, food intolerances, nutritional advice,
Yeah.
behavioral issues. We do a lot because obviously we've got a lot of worried dogs that don't want to be in a vet clinic. Second opinions, like I said, we take that, we can afford to have the time to sit and review cases and kind of sit down and talk with parents and talk about everything that they've kind of gone through and look back over the so many years that they've been managing these conditions. So yeah, and it's quite nice to just do that because you don't always, it's just sitting and reviewing the data at that stage. And so yeah, it can be quite helpful. So we love
Yeah.
that.
Yeah, I love that. And that's what I've said to a couple of my clients is just to have a second opinion.
Yeah.
There's no harm in getting a second opinion. That's what I've asked like for some of them to do and to reach out to you. It's just good they've got that option.
Yeah.
Yeah. They may not want to register to another sort of bricks and mortar practice. They might, might see you as a backup for that. So
Yeah. And I think the other thing is that some people seem like they're really worried about offending their vets and kind of feel like they're kind of betraying them, and it's never perceived as, so I would never take offense if someone wanted to get a second opinion, and you should. It's your pet, it's your baby, it's everything that you care about. So you want to do the best by them. And if you do want to get another opinion or just check your options, because Google can be so comprehensive of all the information these days. You really do. If in doubt and you want a second opinion, do it. There's no harm in it. Your vet's not
yeah.
offended if you do it either. It's one of those things. It's nice to kind of clear it and get all the information you want to sit down and then decisions together.
Yeah, and it's not just Google now, it's AI as
Because
well.
that's
So
a
it's
scary thing,
important
isn't
to,
it? I'll be in
yeah,
case.
it's important. Yeah. So important just to speak to someone that's a human
Yeah.
instead. No, brilliant. And like I obviously I've worked with my own dogs, and we've been able to get like the most recent blood work, and you've had a look at that and things like that. Do you know what I mean? So you've got access to all that sort of information to make a more sort of informed
Yeah,
decision.
yeah, exactly. And I'm not afraid to say, and if I feel like it's not appropriate or I feel like they would benefit, and I have done this, but I feel actually that I'm questioning whether there's more going on here, and I think blood tests are going to be valuable. We do have what we call the Vetsy promise. So if I feel like we're not actually going to help and it's an unnecessary appointment, or if it actually is something that should be urgently addressed, we actually will cancel and refund the appointment and tell you to go direct to the clinic.
Yeah.
So you're not wasting money by booking it. If we're not going to be able to help you, then it is a case of no, let's not go ahead because it's not fair for your dog. So it's something
No, that's really good.
a lot of people are a bit worried about trying something new because it's obviously not something that's commonly available at the moment. I'm sure it will be one day, but
Yeah.
that's
No, I love that because like that's nice. It just gives people reassurance that you're not there just to take money. Like you're doing what's best for them and their dog or their pet,
yeah.
and you're prepared to sort of like you say refund it if it's not necessary. And not a lot of people probably wouldn't do that.
Yeah. We had it was just the other week actually. We had someone who poor little dog was pale. They booked it in for had pale gums and instantly
Mm.
this shouldn't be an appointment at all. Like so we called them up actually before, so they didn't even wait for the appointment. We just called them and said, go to your vets, we will cancel this. And they've actually messaged this week to say that he was a splenic and it was bleeding and had lost a lot of blood. But
Oh,
benign and they've had the tumor removed and he's doing great and they sent us a photo and stuff. I was just like, well, thank goodness. So, yeah,
oh, that must be nice when you get updates like that,
yeah,
mustn't it?
yeah, exactly. Because I always worry. I'm always like, I wonder what happened. I usually do check in, but it's always a bit like, what happened? Because I know that wasn't going to be a nice one. But yeah, so it is something that never
Yeah.
do it unnecessarily. We would say no. It's in the pet's best interest not to do an appointment with us.
I love that. Absolutely love that. Brilliant. Thank you so much, Charlotte. So, moving on to our next section. Again, we've touched on it a little bit, but we can just sort of elaborate and just delve a little bit deeper. So, about vet visits and anxiety
Hmm.
and why it matters. So, what do you think makes vet visits so stressful for so many dogs, please?
I mean, it's essentially because of the just completely different smells, noises,
It
lots of
smells,
other
yeah.
animals around. Clinics normally look very clinical, don't they?
Yeah.
They never look like they're busy.
Little room and it's a bit stuffy and smelly.
Exactly. I mean, there are very few, but I've worked in some really lovely clinics where they've really custom made it and they've selected the color of the floor and it made more natural and it's beautiful. It's really, really lovely. And it makes such a difference. But traditional clinics, and often they are kind of decades old, our clinics these days. But yeah, they can be quite intimidating for that reason. So they've got to kind of get through that overwhelming fear of worry of the waiting room. And then you're going into a smaller room where you've got a stranger kind of handling you, pulling you around, potentially you're sore, and then they're kind of manipulating further, or you've had a previously negative or traumatic experience, which sometimes can be if you've been neutered, and then they've woken up
Mm.
and a bit worried. So if they've had that negative experience, then they are also a little bit, they can often associate it with that. So it becomes a bit of a repetitive cycle. Some dogs don't care at all and they just love to come in and have the fuss and they're really happy and bubbly. But there are those ones that if they've had a traumatic past before, or they are just a little bit more anxious, or their mum and dad are anxious, that's the other thing. If parents
Yeah,
is, then they are going to read off that as well. So that
they were.
tends to be the reasons why.
Two of mine are quite nervous of the table,
Yeah.
but I think it's because like they went and got like spayed, the two girls, and they just don't like the table and they shake now.
Oh, I know. That's
So
glad.
they have to like be
Almost like this.
yeah, so like they have to kind of go down and like do the consult on the floor.
But yours are quite little
So
dogs as well, which can then
mine are all little.
because then they just feel like they're being all coward and trapped. And that's like I hate doing that
Yeah.
because I'm always like, oh, I feel like you're going to be terrified and everyone's kind of coming over you. So it's really tough.
Yeah.
Everyone's very different.
Yeah. And also, I've heard of that some it's the flooring because it's special flooring in a lot of vets, which is easier to clean. And for some dogs, like depending on their paws and their nails, it's the texture of the flooring that they don't like.
Yeah, exactly. So there's some dogs I've had that won't even walk in because the floor is just. So what we do is you can get yoga mats. I tend to try and get yoga mats and I put them down
Yes.
and stuff because as soon as they've got that grip, especially the older dogs, those sort of floors where we can mop them down essentially, which is what you want. And it's those sort of floors that they can actually have a bit of grip on, and then they do feel a bit more secure. So I have been known to put towels and yoga mats around to try and help.
That's really nice. Yeah, we don't want them slipping and sliding everywhere, that's for sure, especially if they're a little bit older. Brilliant, thank you. So I'm really big on early desensitization, particularly like vets and groomers. So how can early desensitization set our dogs up for a calm and positive association at the vet, Charlotte?
Yeah, so I mean, it's essential. It absolutely, I can't recommend it enough. If you can, I mean, you're talking desensitization to essentially being handled is one thing.
Mm.
So if you can start at a young age, and what we mean is regularly kind of doing like the general handling checks and counter conditioning them. So it's always associated with something very positive, whether it's like a treat, reward, or some play, but just having that puppy essentially whilst you can still mold them be exposed to lovely positive environment experiences. So
Yeah,
I tend to certainly recommend kind of getting your pet used to being handled at quite a young age and doing that at home, something
yeah,
that you can easily do. So try and mimic the veterinary exam. And what we typically try and do is examine from the nose to the tip of the tail. So kind of starting around the nose, lifting up the lips and having a little look at the teeth. And again, that's a good chance to get them used to the brushing. So it's hard to brush
mm,
or just mouthy. Kind of just start to get them used to the feel of either like a dental chew or brush in their mouth so they can get used to you doing that. And then kind of lifting the ears, maybe have a little wipe around the ears, going down the feet, touching the nails so they can
oh yeah,
get used to.
between the toes.
Exactly, because they get so many foot shy pups. And also, I mean, if you do have like grooming tools like nail clippers, let them just sniff them, just get them used to being around so and
Mm,
then do it one day and hurt them and then they just don't want it ever again. You can start to do it. But if you don't feel comfortable doing it, don't do it. Just leave it and just touch the toes. And then at least it makes the groomer's job or the vet's job a little bit easier when they do need a nail clip in future. And then I just say kind of run your hands over the body, get them used to that feeling, and then lift their tail up at the end. Because that's that. One day you
yeah,
might need their temperature being checked, and then that will make it a bit easier
yeah,
to vet head to
yeah.
it.
It's nice, the old temperature check for him.
Never, there's no way around it either. It has to be done. So yeah, so that's
Yeah.
kind of that desensitization. But then not like the other way of looking at it is actually desensitizing to the car because often, we don't always need to take
Mm,
just gonna get used to kind of walking around the house and things. So yeah, desensitizing to the car is a big thing to look at doing. So start young. And then the other one is also just the actual vet clinic. So I cannot emphasize enough the importance of happy visits and taking the dog at a
yes.
young age, even if you do have an anxious dog, doesn't even need to be a young age, or you've got a little rescue that's quite worried about socializing, taking them into the clinic, head to the reception, have a few biscuits, let nurses kind of, a few.
I'm glad you said that.
Yeah, I mean, it's the best thing as well. It makes such a difference when you can find the time for a clinic that's going to do that and really build up your confidence. It makes the world of difference when they do need to come in or have something done or need to be examined. They're so much happier about what
Mm,
happens at a younger age. So yeah, definitely.
mm. I was going to say that because you don't always want it to be that when they go to the vets, it's kind of like something, invasive
Yeah.
or bad. But I used to say to my puppy training clients in classes when I was doing training, just to, if you can, take them in once a week, take them up to the reception, give them a few
Yeah.
treats, then they don't always associate it as something like
No,
bad.
exactly. And I get clients to come and they just come and sit in reception, have a cup of tea, and then we have like a few little snacks and biscuits for the pup and a bit more secure really. And it doesn't take much to do, but it really does make a big difference in the long run.
does. It's all those smells, isn't it, as well? Like all the different
Yeah.
smells and obviously what they're seeing and,
Yeah.
yeah, it's so important. I love that. So I think we might have just touched on this again a little bit, but what practical steps can dog or pet parents take to help their pup or kitten feel more relaxed about being handled or examined? So we've got like gentle touch training, handling the paws,
More.
is positive reinforcement at the clinic doors. So we've kind of touched on that a bit, really, haven't we?
Yeah, and I think kind of starting early enough for you doing it, but don't overdo it. So kind of just like 5 minutes really every week, just getting them used to that feel will just be enough to get them more familiar with being handled by others. And I think the
Yeah.
other thing is if you are a pet parent who is anxious or you have an anxious dog and therefore it's very justified to be anxious because you've obviously gone through that worry of the dog being reactive or what they're going to do in the waiting room or how they're going to perceive the vet, you yourself need to also try and stay calm. that's that,
Yeah.
that's a big thing as well.
Some
They read
some breath work or
yeah, exactly. I mean, 100%. Like, what do they call it? The four squared breathing technique. Like,
oh yes, yes.
I mean, I swear by that. I do it all the time anyway. But it makes such a difference if you are worried. And I have had and one of the things actually I've learned through Vetsy is the amount of clients who are just so anxious to talk about anything in depth with their vet because
Mm,
is I've got to get out into the waiting room and deal with that. And I just want to get out. Like, they don't want to then
yeah.
in pain and things like that. So they often don't then listen to half the advice or feel like they can't talk openly enough about their concerns, whether it's behavioral concerns, they almost feel like they can't really talk about. So doing it in the comfort of home is a lot nicer because you can just do it
It
with a cup of
is.
tea or something stronger you
Mm,
need. But it just means that you can then really have an open conversation. And so many people have said to me, it's made such a difference just being able to do this and kind of, but I do think if you're quite worried in that sense, the dog's going to read your body language, they're going to read off you, and therefore it's not going to help how they feel in that one as well.
yeah. No, I know. I definitely pick up on how I feel. As I was saying, I was just thinking I'll get some rescue remedy under the tongue or something just to
Yeah.
like, make you chill a bit out.
Yeah, absolutely. A really interesting thing where they say if I don't know if you probably do know this, but it's essentially like if I often find in a consult you can stand and the dog will do this thing where they lean on you or they sit on your feet. Do your dogs do this? Like,
Yes.
and if they
Yeah, yeah, they lean in.
is they're reading off your how tense you are, how scared you are about this
Yes.
and they're so intuitive
Yeah.
how you are. And I don't think people quite realize that. They think they're just like, oh, they're just being cute and they're just sitting on me. Like, no, they're reading
No,
or happy. Like,
they're reading your body
yeah.
language.
And it's
Yeah.
fascinating how much they can actually get from us. And so, yeah, it's so important to stay relaxed.
It is. It is. Do you have any sort of stories or personal sort of wins that have happened, like either in practice, like with a nervous or anxious dog or parent at all?
Yeah. Quite a few. Yeah, I think, I
Yeah.
mean, probably probably the biggest one I've had recently was a very dear patient of mine, Freya, who was a very, very sad story. A little gorgeous English Bull Terrier who sadly had been stabbed by a malicious previous owner 9
Oh,
times and had presented like out of hours clinic and had to kind of go through this huge kind of undergo a lot of extensive surgery and treatment, which is just devastating. But she was fortunately rehomed and her mum was one of the nurses working at the clinic. But because of full experience, it left her with such severe anxiety and
not surprised.
just like not the same dog. She was just traumatized. She ended up having to be on anti-anxiety medication, but then basically found any time she felt pain, for example, just naturally with age, then affected her anxiety even further. So I met her through Vetsy because she kind of came to us for kind of pain medication and her anxiety medication, and we managed that for quite some time. But then sadly, she got a mammary lump. And so I ended up seeing her in practice after that. And we did the mastectomy to remove it, but it was quite high grade. And it's a bit of a sad story, I'm afraid. So yeah, so
Oh,
It was
okay.
advanced, and we ended up deciding to go with palliative care because we didn't want to put her through the stress of handling, because veterinary visits just weren't the option for her. It was just too stressful for her. And we never wanted her to feel any
Mm,
discomfort. And, even if you do chemotherapy and things, it's regular blood testing and intravenous injections. Often it's a lot for any patient to go through, especially one if you're quite anxious. So we went for palliative care and we did a lot of it remotely, but definitely got more time than we expected with her. But she's one that's really,
mm,
I think, sat with me quite a lot recently. And yeah, she's
not surprised.
sadly we lost her a few months ago, but she's dear. She's left a little paw print in my heart for sure.
Oh God, I bet there's a few that have done that over the years.
Yeah.
I mean, I don't know if I could do your job. I mean, hats off to you. You're amazing. But yeah, it must. God, it probably was on the
I
heartstrings.
know. Well, yeah, I definitely it can be. I think I'll get more emotional with age as well, so
Same.
it's fine. I just cry along with them.
Yeah, I mean, I've always been emotional, but yeah, I'm definitely more as I get older. Brilliant. Let's move on to our next section. Thank you so much. So, helping the pet parents feel empowered. So many pet parents feel anxious themselves. So we've sort of touched on this about the vet visit. So yeah, how can we keep our emotions in check so we don't pass that stress on to the dog? So like you said, it's probably about doing some box breathing and
Yeah.
listen to some meditation and
Yeah.
just getting yourself.
Yes, yeah, and I think, I don't think people discuss enough openly with their vets about how they feel about the appointment. So, if you
Mm.
worry about sitting in the waiting room, just let your vets know, sit in the car. Like, I would happily do
Oh yes.
if it meant that it wasn't going to be, anxious pet or worried mum or dad. And so yeah, or sit in the car until you need to be seen. Obviously, there's always the
Yeah.
option for home visits or video vets.
Yeah.
But yeah, I just think it's one of those things that just talk openly, let your vet know how you're feeling. Vets are there's loads of things they can do. And also, if you do have really, really anxious pets and you think, I just can't get them to the clinic or even get them examined, there are things that we call like chill protocols, like kind of tablets and meds that you can use just to take the edge off them before their appointment. That I'm sure if you talk to
Mm.
your local vets, they would also happily recommend doing that.
Yeah.
No one wants to go through the stress of blood samples,
No.
drains and muzzles. It's awful. No one wants to do that. So, and if you feel
Mm.
like you're not happy about the way your pet is being handled and you
Mm.
discuss this openly with your vets and you still don't feel comfortable about it, then I don't think they're the vet for you. And then I'd say that
No.
try somewhere else.
Yeah.
There definitely are many, many vets out there who handle appropriately and are more than happy to support you.
Yeah. Yeah. I've recently changed to a different first opinion vet, and yeah, definitely you've got to. It's like with a lot of things, isn't it? You've got to get with someone that you sort of gel
Yeah.
with, like
When
you
you
got to get
can
on well with them.
the value of that pet client patient relationship is so important, and if you've got that
Mm,
trust, then you're going to have those open conversations, aren't you? So I think
mm,
yeah, I think if you just clash and you're not getting anywhere, then it's
yeah,
worth trialing somewhere else and just seeing if
yeah,
you feel more comfortable with who's looking after your animals at the end of the day.
yeah. It's mad because I'm a dog trainer, qualified dog trainer, and behavior consultant. Like, even though I don't practice as much anymore, like I didn't even think about how they pick up on our
Mhm.
stress and how I must be feeling.
Yeah.
Because I'm an anxiety Annie as it is. I suffer with severe anxiety, believe it or not. So I didn't even think about how they would feed off of that and pick up on you. And then also to tell your vet how you're feeling as well.
Mm, yeah, absolutely. I think it's normal
Yeah.
as well. Look, if you've got your pet in and it's not just a booster or it's, not just a mild ailment, but actually you've got a very sick animal, of course you're going to be worried. I think
Mm,
you can't ever overlook that. And I don't think if you've got a dog that's been sick all night or is coughing excessively or struggling to breathe, you have every right to be a worried owner. It's something
mm,
yeah, the last thing you want to do is then stress about actually having to do that visit when you're already worried enough as it is.
mm. Yeah, I know. That's why I do my Vetsy
Yeah.
consults now. That was a lot easier for me.
Yeah.
Brilliant. Thank you. So it's important as well in terms of knowledge and understanding what's normal versus what needs a vet's eye, isn't it, as well? Like you say, you've got to be careful.
Yeah.
There's a lot of, Google doctor, Google vets.
Yeah.
It's important, isn't it, to get a vet to look over certain things,
Yeah.
really.
I mean, that's the thing. Don't be, obviously, I think everyone kind of knows these days that what you put into Google, if you put enough in, AI will generate the answer you're looking for. So you need to be very, very
It tells you you're dying. You've only got to put in there you've got a headache and it
always.
says get to
Yeah.
A&E.
Absolutely. So yes, but I
We're
think
doing it
that's
with our
really
pets.
your
You'd
work.
be...
But I think the other thing I would always say, and I think most vets would also agree, is that if you are not sure, just ask. Just send us, if you email
Mm,
me or send us a message or kind of call your vets. Most of the time we'll say, do you know what, you'll be okay, wait. They're not going to always be like, yeah, you got to come in, you got to come in now. So most vets would be more than happy to just give you advice if you're not sure.
mm,
There's a thing between Vetsy and being seen in practice. Our big thing is essentially, if this is an emergency, you don't come to us. We're not going to be able to do any form of emergency care. So I'm more than happy to review things if you're not sure and then say yes or no. But essentially, if in doubt, just send us a message or contact your vet. Email that
yeah,
best, and they'll usually guide you fairly, I think, as well.
yeah. It's so important. I think you like when you said about as well, it's important to communicate because like I have seen because I've worked in a practice before. I was reception, but the vets will go out and do the consult in the car or in the boot if you need them to, and or they may come out to your home with they have to bring someone with them for insurance, but if you just speak to them, they don't want you to be stressing and your animal to be suffering.
No,
So
exactly.
it's important to communicate.
Yeah, absolutely.
Right. Okay. So yeah. So talking about Google, then. So how can online I can't even speak now. How can online consults help reduce that panic googling and empower our guardians with more clarity?
Yeah, so I mean, I think that kind of comes in with that kind of either second opinion or tele-triage medicine. So if
Mm,
we do a consult, we could then just discuss the concerns. Sometimes a lot of people just want to know, like, do I need to go out of hours on a Sunday night, or can this wait till the
yeah.
evening? And
So,
based on how the dog's presented, we can often tell you that. So it can obviously significantly save on vet fees by doing that. And as I said, from Vetsy's point of view, if we did say no, this needs to be seen now, we would just refund you anyway. But
mm,
also, if so, many, which I say, like many treatment plans can potentially need like trial treatment first. And so you'd be like, oh, well, why don't we see how we respond with this? Say, for example, a course of probiotics for diarrhea. Let's see how we respond to this and potentially a little diet change. And if that's not getting better, then often you want to look to do further diagnostics. And that's where you could potentially say, right, well, you could start with the online consult and see how you get on. But if we're failing to improve as we would have hoped, then I would certainly discuss next steps with your vet. And that's how we would suggest going about it.
mm. No, so I just think it's great. It's just another option, really, and I think more people should use it, and hopefully they will as well. And obviously, by getting this episode out, it will help shine more of a light on it, and obviously, particularly your service as well. So, just moving on, we're starting to come to the end now, but our next section before we start wrapping up is just broader vet wisdom. So, Charlotte, what do vets wish that all dog parents knew? Is there any common myths or mistakes?
Mm. Yeah, but do you know what my my bugbear is?
Go for it.
No, it's not. No, people's misconception of they're just getting old. My dog's just getting old. That's normal. Is really that I
Mm,
think shouldn't be overlooked. So dogs slowing down, or cats to be fair, slowing down, showing stiffness and difficulty in getting up in the morning. We put that down as aches and pains and just getting older, but actually that can be an indication there is chronic pain there, and chronic pain is something that we shouldn't ignore. So it is
mm,
something that this whole kind of, oh, they're just getting older, they are going to slow down, is something that we want to avoid. You wouldn't want a dog to have any day in discomfort. And if they are showing that stiffness and getting up, or that little hobble down into the garden, that is a dog that is in discomfort. And if they're showing,
Mm.
probably more advanced than you realize. So yeah, that's my kind of my bugbear. And I think the other one is this, going kind of on with geriatrics in general, but there's this whole thing of they're too old to undergo an anesthetic. If
Right.
comes up quite a bit, because it's usually the old dogs that need a dental, for example, and then they're like, oh, no,
Yes.
I shouldn't do that because they're too old to have an anesthetic. But we would put 90-year-old ladies under general anesthetic for total hip replacement, and we don't question it.
Mm.
Like, it is something that we can, you tailor the anesthetic, and you don't want to leave a dog with a sore mouth, because that would be awful. And if we can go for things like dental treatment, I would definitely encourage that, because it's much nicer for them.
Mm.
It does, it comes with its risks. If you leave an old dog with significant dental disease, it does pose a risk to the heart, to the kidneys as well. So it's something that you do want to do
Mm.
and not ignore. You still could have a good few
Yeah.
years with them. So yeah, that's my two bugbears.
No, I'm glad you said it. We're going to be touching on dental in a second, but I was going to say that dogs, and I've learned this, they're very good at masking pain,
Yeah.
very good at hiding pain,
Yeah.
So it is, if you are thinking, oh, my dog's old, and it's got general aches and pains, they do put up with a lot.
Yeah, exactly. And they accept it as normal, which I find really sad, that they think that pain is normal. Like, you'd never ever want that. So
Yeah.
so I don't
No.
ignore it. And they don't always,
And
not always lame with it either. So that's what some people are like, oh,
no.
lame, but that's because both legs are affected. So that's why they're not obviously lame. So that's why it's kind of like,
Yeah.
they're stiff, or they're struggling, they don't make the car jump anymore, or they really struggle to get up and down the stairs. Those are those real subtle signs that we probably shouldn't be ignoring.
Mm. And oh God, it's gone out of my head. I was going to say something about. Oh, it's gone. It might come back. So, the importance of preventative care like dental, weight, exercise, and enrichment. What's your views on that?
Where do I start?
Wow.
I mean, it cannot really be overlooked. Those sort of subtle, low level kind of preventative care will significantly save on the cost of pet care later in life. So I know brushing teeth is tedious, and yes, the gold standard is to do it as often as you can. No, it's not feasible to do in general life. And I will openly admit that I struggle to find time to do my own dog's teeth. But if you can get into the habit of getting it in once or twice a week to give them a brush, it makes such a difference. It's the best thing you can do for dental care. And if you do need to undergo a dental scale and polish, I also would encourage it to be done under anaesthetic, because you can get a really good clean done in comparison to doing it like at the groomers, where they do with the ultrasonic scaler. Something we say is that it's almost like the tip of the iceberg. So what they do, it looks good, but actually the inside of the teeth
What's going
and
on?
everything else is still not addressed. And so it's not really a good use of your money. So we would certainly say, doing it under general anesthetic, have a good proper job done. Hopefully you don't need to do it ever again. I know it's expensive. And so if you can avoid it and do early dental care with routine brushing, dental chews, and kind of hygiene products, then great, do that. And similar weight. I mean, it's
Yeah.
knows that being overweight can predispose to other health concerns such as joint disease, heart disease, diabetes, thyroid issues. It can all add up. Nothing
Yeah.
better than managing a diabetic patient. So if you can avoid it with appropriate diet plans, then again, that's something to look into. And Vetsy's perfect for that sort of stuff. I've got a lot of Weight Watchers on my books that we do.
Yeah. Weight clinics, monthly weight.
Yes, we do.
Yeah. Brilliant. That's what I was going to say. So, normally, if there's a change in behavior from my training head on, that can indicate like there's some pain, because if I've got a toothache or a headache, it affects my behavior. It's the same for our pet.
Absolutely. Yeah. I mean, it's probably one of the most common reasons I see reactivity in a lot of the patients is often there's underlying pain there. And we've had a few cases where we've ended up kind of saying, look, go for x-rays, or we've got under physio care. because of, you can see gait, like changes in their gait or their posture, and sometimes their reactivity becomes more heightened, and that's when we know, right, that there's something else going on here. So yeah, it certainly can't be overlooked. Any change, subtle kind of change in behavior, energy levels, kind of overall demeanor is usually quite significant. So if in doubt, definitely don't hesitate to reach out to your vet.
Yeah, so important. Perfect. So our final question here is, how can pet parents build a more positive partnership style relationship with their vet, Charlotte?
Yeah, I think the trick is being open and honest. Don't hesitate about having that conversation with them. Like we said, if you are anxious or you're worried about your anxious dog, I think there's going to be so much trust if you feel that you can actually openly discuss this. And, there's no harm in, if you have done a bit of research and want to kind of make suggestions and treatment plans, or at least sitting down and discussing that fully with your vet, so you can both make an informed decision together and a little bit more of a plan that you're both on board with, then yeah, I think kind of the best way to establish that trust that you need.
Definitely. So important. Right, our quick fire round just to wrap up then. So, Charlotte, what's your favourite dog breed to treat?
Oh, I think that's a really mean question.
I know it is, isn't it? You can have more than one. We're not allowed favourites.
I know, I can't believe it. I think, well, I'm a Cocker Spaniel owner, so I have to have
You
male
are.
to my Spaniels. I do love a Frenchie. I know that
No, you do.
it's probably quite naughty of me as a vet, but I do love a Frenchie. I'd say they're quite naughty. And also
That's okay.
Staffies. I do love a Staffy.
Oh, they're so misunderstood. Yeah. No, I like staffies. All right. So if Vetsy had a slogan for dogs, what would it be?
Well, we do. I think our actual slogan is, because going to the vets is so 2019.
Yeah, saw that. Yeah, I've seen that
I'll go
before.
with that one.
Is that because it's before COVID or
Pre-COVID
something?
days, yeah.
COVID day. Yeah, I love that. So, what's one tip every dog parent should walk away with from this conversation?
I think I would probably say looking to really have those open, frank conversations. Do not be scared to talk openly with your pet. And if you don't feel you can, you probably don't have an open and transparent relationship. And therefore, it might not be the vet for you. That would be my advice.
Brilliant. Charlotte, where can our viewers, listeners find out more about you and Vetsy, please?
So you can find our website, which is www.myvetsy.co.uk. And you can see all our information on there. We've got lots of Google reviews as well. So if you want to have a little snoop through them, go ahead and have a little look us up.
Brilliant. Thank you. Dr. Charlotte Gray from Vetsy, thank you so much for joining me on the Yappy Hour powered by Yappily today.
So thank you so much for having me.
Oh, you're most welcome. Absolutely love this conversation. I'm really looking forward to it. So thank you for joining me, and we'll chat again soon.
All right. Thanks, Nathan. You take care.
And you.
Bye.
What an episode. A huge thank you to Dr. Charlotte Gray from Vetsy for such a practical, reassurance and inspiring chat. I think the biggest takeaways for me are: number one, online vets are here to support, not replace. They give peace of mind and reduce stress for anxious dogs and their guardians. Number two, preparing dogs early for vet handling makes the world of difference. Little steps at home can build trust for life. Number three, and maybe most importantly, guardians don't have to feel alone or overwhelmed. Support is right there at your fingertips. If you'd like to learn more about Vetsy or even book an online consult, we'll pop the links in the show notes. And don't forget, you can also use my code PAWCARE for 20% off your first consult. Thank you so much for listening. And as always, please share this episode with another dog parent who might find it useful. Please subscribe and leave us a review. And until next time, give your dogs a cuddle from me, and I'll see you again on the next Yappy Hour.